welcome to this IDEXX sponsored presentation titled CBD, Keep Calm and Monitor On. My name is Eva, and it is my pleasure to introduce Stephen Cital. Mr. Cital is a registered veterinary technician and veterinary technician specialist. He's also one of the first veterinary cannabis counselors in the country. Mr. Cital served as the executive director for the Academy of Laboratory Animal Veterinary Technicians and Nurses, and is employed at Stanford University as a laboratory manager in the neurobiology department. I'm sure you'll find his presentation informative. And now I'll pass things over to Mr. Cital.
Hi, everybody. Stephen Cital here, RBT out of California, VTS and lab animal, a bunch of other things, doesn't really matter. If you want to find more about me, you can visit my website at stephencital.com. Otherwise, I am super happy that IDEXX is sponsoring this lecture on a really important topic, quite a controversial topic, to be honest, and that is on CBD and what we should be doing as far as monitoring, since we know that clients are going to be using this product, whether we recommend it or not. What is best for that patient? What is best for that client? So let's talk about some of this monitoring and some of the other things that we should be concerned about if an animal is going to be on a CBD product. But first, we need to kind of understand what CBD is, what system it's working on, and why it's so relevant today, and why we're seeing more and more lectures on cannabinoids in general at veterinary conferences. So CBD is only one of hundreds of different molecules that come from a very special plant known as the cannabis sativa L plant, Linnaeus, if you want to get all Latin and technical there. And it is a very popular molecule because people want to use it for anything and everything. And we have to be careful there because there are some indications where maybe CBD wouldn't be the best thing for that patient. Maybe THC, which is the other cousin of CBD that intoxicates animals and people, that might not be best for that animal. And certainly dosing is very important. But where people get this idea as far as these molecules having a pretty good therapeutic response for a whole host of things come from some pretty big and legitimate institutions like the National Institutes of Health. This is a really interesting kind of review study that was published in 2013 by NIH scientists, where they suggested in their introduction for this paper that modeling or modulating the endocannabinoid system, the system that all this stuff works on, activity may have therapeutic potential in almost all diseases affecting humans. I would insert animals in there as well. So, even these big institutions, these credible scientific institutions do realize the potential therapeutic benefit of these molecules. With that said, we do need to have good evidence behind the use of these compounds, and we're still kind of like figuring that out. We have some ideas about how these molecules are useful for certain things, in particular like osteoarthritis. It's a big, very common and now well-studied condition for CBD, but other things maybe like cystitis in cats, or actually killing cancer cells, we still need a lot of work. So it's hard to throw those claims for these particular products. What's also kind of interesting is when we talk about this endocannabinoid system, this thing that these molecules work on, all mammals have a very active and very similar endocannabinoid system. So it is pretty easy to extrapolate from what are considered lab animal species or lesser species, things like rodents, up to cats and dogs, even to humans. The endocannabinoid system does pretty much the same thing, and its main role is to create homeostasis within animals. That sounds a little cliche, sounds a little woo-woo, things create homeostasis, yeah. But that's actually really important because our body is always in a fight to remain in a homeostatic balance, right? We have to have our core temperature within a certain narrow degree temperature for normal physiology. We have to have our pH in our blood at a certain narrow range for normal physiology. We have to produce neurotransmitters and other important signaling molecules for normal physiology. So homeostasis, even though it sounds kind of cliche and a little bit woo-woo sometimes, it is actually a very important function. And if we have what are called adaptogenic diets or adaptogenic molecules like CBD that maintain homeostasis, there is a theory that we can create balance and better health in general. Now, before I get too crazy, I know I threw out a lot of vocabulary already. There is some important vocabulary I think is really important for this lecture and for just discussing this topic in general. And so here are some of the big words that you're going to be hearing a lot throughout this presentation and certainly in conversations with clients and other veterinary practitioners. So the first word is phytocannabinoids. So phytocannabinoids is two words put together, phyto coming from plants, cannabinoids being a certain set of molecules that work on these special receptors known as the endocannabinoid system receptors. So put it together, phytocannabinoids, these are molecules that work on these receptors that come from a plant. Does that make sense? I think it does. Endocannabinoids, endo meaning from within, cannabinoids again being that molecule, put it together, are molecules that your body produces that work on the endocannabinoid system and sit on these endocannabinoid system receptors. Then we have the word terpenes, and terpenes, AKA essential oils, talk about woo-woo, right? Terpenes are a legitimate thing, however, that do have some therapeutic benefits unto themselves, and they help create this thing called the entourage effect. Terpenes are also the smelly part of the cannabis plant, whether we're talking about marijuana or hemp. If you've ever smelled those, maybe in high school, maybe in college, maybe as an adult, there are a lot of recreational states out there. Terpenes are the guys that are creating this scent, these classic smells of these different cultivars or varieties of plants. Flavonoids, on the other hand, are the flavor profile of those same plants. So where terpenes might add this earthy or oaky or strawberry type smells, the flavonoids are the ones that give them the flavor. And what's interesting about most terpenes and flavonoids is they actually are FDA approved. They're considered GRAS, no pun intended. It's an acronym for generally referred to as safe to add to food products. So we do consume these regularly. Pretty much all of our fruits and vegetables have terpenes or flavonoids in them. Again, that's where we get these smells and flavors from these particular products that we eat daily, or we should be eating daily. So these are relatively safe molecules, but they do have a really influential role in how CBD products in general work. And then we have the word I keep saying over and over again, the endocannabinoid system. This is the set of receptors within the mammalian body comprised of the CB1 receptor and the CB2 receptor, where we have endocannabinoids that sit in those receptors. And then we have phytocannabinoids from the plant, things like CBD, THC that can come and sit either within those receptors or on the side in what's called an allosteric binding site. Now, I keep mentioning hemp and marijuana, and we need to be very clear on these definitions. And for the rest of this presentation, we need to understand that I am largely talking about hemp products going forward. So what is hemp? Hemp is a cannabis plant that has a fairly subjective definition of having less than 0.3% THC, which is the intoxicating molecule in it. And a marijuana plant is a plant that has greater than 0.3% THC in there. So it is very difficult, mostly unlikely that you are going to get yourself or your animal intoxicated by using a hemp product. That is a federal definition. That is a legal definition in most states as well. Marijuana, there is less use of this word. It is slightly derogatory in some circles. There is a bit of racism behind this word in particular. So a lot of states and federal legislation has adopted cannabis, although that is technically the genus species name, in lieu of using the word marijuana. And again, cannabis or marijuana in those contexts have greater than 0.3% THC in them. And at the federal level are still considered a controlled substance Schedule 1. So those are things that we would probably want to stay away from in practice right now, unless laws tend to change. So going forward, we are mostly talking about hemp products where it's CBD dominant, not THC, risk of intoxication very low. Now, the other thing that we need to kind of understand when we're talking about these types of products with pet owners are the different varieties of products that are out there. When we're talking about CBD type products coming from different companies, we need to understand that these products are coming from a plant, and depending on where that plant is growing, how much sunlight it's getting, the water quality, the soil quality, the fertilizers it's getting, when it's harvested, all these different little things can affect the different cannabinoid levels in these plants. So when we think about a hemp plant and you think about the flower, so like this is the flower of the plant, there are these little hairs on the outside of the plant. They're called trichomes, and that's where things like CBD, these terpenes, these flavonoids, some other really interesting things are excreted outside of these terpenes, and then it's harvested. And depending on the extraction technique that the company is using to harvest those really important molecules from these plants, we will end up with one of these three categories, either an isolate product, which is typically only one molecule. We have broad spectrum products and we have full spectrum products, sometimes called complete spectrum products as well. So isolates, as I mentioned, are usually one molecule or very, very low amounts of other things in there. There is an FDA-approved product right now called IDEXX, and that is essentially a CBD isolate. What's interesting about these isolate products is typically you need a higher dose of these isolate products to get the same efficacy as you would from a broad or a full spectrum product. And we think that is because of this thing called the entourage effect. Now, the entourage effect is just a really fancy name for synergism or synergy between different compounds or potentiation. So we use synergy and potentiation when we're thinking of like pain management or anesthesia protocols, right? We know that if we give a non-steroidal anti-inflammatory and an opioid together at the same time, we can usually decrease the dose of the opioid. We know that if we give ketamine with propofol at the same time, we can decrease doses of both drugs and have a smoother, more comfortable plane of anesthesia for that patient. We kind of see the same thing with broad spectrum and full spectrum products as well. And again, we can use lower dosages. Broad spectrum has kind of this ever fluctuating definition, but my definition and the definition I really like to speak to is broad spectrum has most of the things that the plant has to offer. So the company or the extractor has kept most of those phytocannabinoid compounds all together and hasn't necessarily picked out certain ones. But some of them may have been lost during processing. We might also see less terpenes in there after extraction. And then some companies even consider broad spectrum products products that have all of the things without THC in them. So broad spectrum generally means it has most of the things, but maybe missing a few things here or there. It is tricky, however, because technically broad spectrum just means you have more than one molecule in this product. And so there are companies that are maybe a little bit dishonest with you, and they have CBD and maybe a terpene, let's say beta-caryophyllene, for instance. So it has just CBD and beta-caryophyllene, which is a terpene. So technically that company can consider their product a broad spectrum product, even though it's not necessarily meeting the definition I have bouncing around in my head of having most of the things the plant had to offer. And I'll tell you how to mitigate that problem in a second. And then we have full spectrum products. These are products that have all the things that the plant has to offer. Oftentimes companies, really diligent companies, are even putting these molecules in a carrier oil like hemp oil, instead of putting it in like a MCT oil, aka coconut oil, or putting it in like extra virgin olive oil, they'll put it in hemp oil. So full spectrum is really the products that I really like to use because it has all the things. We can use much lower dosages and we definitely get better responses compared to some of the isolate products. Now, people ask about dosing all the time, and I hear the argument, oh my gosh, we don't have any studies on this stuff. That is inherently untrue. We have we have way more studies on some of these compounds than we have for a lot of the drugs that we use in veterinary medicine. And we certainly have studies now showing efficacy, especially compared to drugs in veterinary medicine. Let's say tramadol, for instance, which shows no or very poor efficacy, but we still accept it and still use it. So we actually do have quite a bit of evidence when it comes to CBD products in particular. Now, this is one study out of 7 PK studies that I'm aware of for dogs so far. I know there are a bunch of other PK studies going on right now, which is a pharmacokinetic study, seeing how much the body is absorbing. And what dose might be most appropriate. So this is just one of 7 that is published already. And this one's kind of interesting because this one was kind of deciding, hey, should we give these products with a fasting animal or a fed animal? And what we found so far is that it kind of depends on the product and what it's formulated in, but generally we can get away with giving these products in a fasted animal or a fed animal. There is some argument that lipids like lipids, CBD is a lipid, so it can hang out with other lipids, maybe in the food, and get absorbed better. But we do have plenty of studies, quality studies, showing good absorption of these compounds in animals, cats and dogs. Interestingly enough, our cat little friends seem to require a higher dose. We'll talk about that in a second when we start to talk about some of the liver consequences when animals are on these products. Now, I talked about mitigating some of the concerns about the quality of the product and what is in these products. This was a study that I was part of that came out last year in 2020, where we actually pulled 30 over-the-counter veterinary labeled hemp products. We did have to disqualify one of the products because one of the products actually had no CBD in it whatsoever, and they were just using hemp oil. So we do have to be cautious. If a client comes in and says, oh, I'm using hemp oil, does that mean hemp oil from the seed and the stalk of the plant? Or does it mean hemp oil that has CBD and other phytocannabinoids, terpenes, and flavonoids in it as well? So we have to be a little bit careful and read that label carefully. But what we did for these 30 products, and this is what I would recommend for every pet owner, every practitioner that's interested in carrying or potentially using these types of products, is ask the company for what's called a certificate of analysis. On that certificate of analysis, you should see the breakdown of the different phytocannabinoids that are in that particular product and the concentration that they're in. So it should have CBD on the certificate of analysis. And on that certificate of analysis, it should give you the mg per milliliter concentration. So it'll say CBD, 50 milligrams per milliliter. Great, that's what we want to know. 1, for dosing of our patients, and 2, to make sure what's in this stuff is actually matching what's on the bottle, right? The sad thing that we found in this particular study was there were companies that were selling products, in particular number 10 and number 27, that were labeled as having CBD in them. But when we tested them at a third-party lab, had no CBD in them. Instead, what those companies did is they spiked those products with a lot of terpenes, so it smelled like marijuana, it smelled like hemp. So to the unknowing consumer, it probably would seem like a legitimate product, but in fact, it was just terpenes, and they weren't actually spending money on these compounds that they thought they were buying. The other kind of interesting thing that's very concerning is we did find some other contaminants in these products, in particular elemental contaminants, heavy metals being one of them. So a couple of the products did have higher levels of lead in them. One of the products had such high levels of lead that it would actually be considered unsafe to sell and consume per the federal USP guidelines. So on a certificate of analysis, not only will we see a breakdown of the phytocannabinoids that are in these products, we will also have an elemental analysis. We should also see on a complete certificate of analysis a pesticide or a fungicide analysis. Like I said earlier, these molecules grow on the outside of the plant on these little hairs called trichomes. So if you were to spray it with fungicides and pesticides, it's going to stick in those resins that the plant is producing. It can be difficult to get out during processing. Also on that certificate of analysis, we should have a pathogen or a microbiological analysis as well to look for things like E. coli and salmonella. There should be a mycotoxin analysis to make sure we're not giving these animals any sort of dangerous spores. And then there should also be what's called residual solvent analysis. So depending on, again, the extraction of these particular compounds, some companies might be using butane, some of these companies might be using ethanol, some of these companies might be using CO2, and depending on what they use, some of that stuff can get left over in these products. So on that certificate of analysis, you'll be able to see if there's any leftover, and if the amount of leftover solvents are in there, if it's safe to consume. There are a couple of states that I really like their standards, and I like to see that on a third-party certificate of analysis because they're more stringent compared to other states. And those two states are California and Massachusetts. California and Massachusetts have some pretty stringent guidelines as far as other contaminants that might be in these products compared to other states that were, in my opinion, good at one time, but maybe less favorable now, in particular from Colorado, right? Colorado is a big popular state for growing cannabis, hemp, or marijuana, but they've changed their allowable limits of some of their pesticides, residual solvents, and elemental analysis from a pretty low and pretty stringent amount to a pretty high amount that I'm just not super comfortable with. I don't believe in giving our animals higher levels of things that can be toxic if we don't have to. So biggest considerations, other than some of the health stuff that we are considering, is certainly the quality of the product. And you can assess the quality of the product, again, by asking that company for a certificate of analysis. That certificate of analysis should be from a third party, and hopefully they are 17025 certified, meaning there is another third party coming and inspecting that lab to make sure they are following good lab practices. Outside of the quality of the product, we also want to look at the dose and length of use, or take that into consideration for that particular animal. We want to look at polypharmacy. Hey, is this animal going to be on the CBD product in conjunction with other medications? How is that going to be affecting the animal? The general health of the animal. So remember that thing called the endocannabinoid system that I talked about? The endocannabinoid system itself can become sick. And there's even this deficiency called the endocannabinoid system deficiency, where parts of the endocannabinoid system maybe are not as active as they should be. So the endocannabinoid system is these two receptors, but it's also a set of enzymes that break down those things called endocannabinoids. It's also the number of these receptors that we have available. So if you are sick or you have traumatized tissue, you generally have more proliferation or maybe more pop-ups of these baby endocannabinoid system receptors. We may have a very active or not so active amount of endocannabinoids being produced to stimulate these endocannabinoid system receptors. Hence, people want to supplement it with plant-based cannabinoids. And then we may or may not have enough of those enzymes that are supposed to be breaking down those endocannabinoids. So general health can speak to maybe the dosing that we should start with for a particular animal. And that is generally considered the endocannabinoid system tone. How active, how healthy is that endocannabinoid system based off the general health of the animal? That was a mouthful, wasn't it? Now, we also need to be very, very cognizant of long-term monitoring for health and success when an animal is on these types of products. So we're going to talk about how we can assess that. Now, when we start an animal on these types of products, we might hear of some certain adverse reactions. We're going to talk a little bit more in depth about those, but in general, we typically see lethargy, maybe some regurg or some vomiting, maybe some soft stool as well. And that's where we want to check the product and certainly the dose that we are going to be using in these animals. Dosing is kind of all over the place depending on the medical condition, but in general, it's a pretty broad range, anywhere from 0.5 milligrams per kilogram of CBD to 5, even maybe 10 milligrams per kilogram of CBD for some of these animals. So in general, when we're talking about dosing, I really like to start low at that 0.5 mg per kg twice a day and work my way up week by week, kind of doubling that dose to see if we can find that sweet spot for that particular animal. Of course, if you have other adverse reactions, again, going back to that certificate of analysis, making sure we don't have contaminants that could be potentially making those animals sick, and not necessarily just blame the CBD molecule. We need to have an understanding of the carrier oil as well. You know, does this animal have dietary indiscretion with the particular carrier oil that these molecules are being mixed with? And then if we have pretty severe adverse reactions, we certainly want to consider stopping altogether and not continuing on, or pausing that particular dosing for that animal to see if it's actually related. Because remember, correlation is always not causation. Most commonly seen adverse reactions, as I mentioned earlier, we see lethargy, vomiting, and maybe poor stool quality. There was one study out of Colorado State University where they were giving 10 and 20 mg per kg. Those are pretty high dosages, typically not dosages we get to in most clinical settings, but that's a lot of oil that you're feeding an animal. And when you feed an animal a lot of oil, it can act as a laxative. So I wouldn't necessarily blame the vomiting or poor stool quality in that particular study on the CBD compound itself, but certainly the amount of oil that those animals were getting. Less common adverse events that we might see from these types of products are things like inappetence, in particular with higher dosing. And when I say higher dosing, I'm thinking of doses greater than 5 milligrams per kilogram. At higher dosing, CBD can actually act as more of a stimulant, which is kind of interesting. We have some really crazy pharmacological reactions when it comes to CBD. But at higher dosages, it can act as a stimulant. And when you are kind of stimulated by a particular compound, appetite might be suppressed. There are also terpenes, certain terpenes, those smelly guys, that can be appetite suppressing as well. One of those terpenes that you should be able to see on your certificate of analysis when you ask for one is humulene. So humulene, H-U-M-E-L-E-N-E, is one of those terpenes that could be causing appetite suppression in that animal. We also might see pruritus or itchy skin. Again, I am not convinced that is from the CBD because we have studies showing that CBD can actually help prevent and stop pruritus. But some of those terpenes, maybe some of those flavonoids, again, maybe that carrier oil can cause allergic reactions or change in diet in general. We always see these kind of increases in itchiness, vomiting, poor stool quality, that kind of thing. So pruritus might be something that can happen. It is not very common, but it is worth noting. Rare but noteworthy, we might see hyperesthesia, and we might see some weird behavioral changes, especially in brachycephalic breeds. Pugs seem to do funny things when they're on CBD products. Not funny in the sense of like scary and I would stop, but just notable things. And Labradors, can act kind of funny on different Benadryl dosages, right? So CBD does kind of the same thing in those breeds, at least anecdotally. Would it make me stop? No, it would just make me reassess the dosing for those animals. But hyperesthesia is something that we can certainly see in any breed animal or species animal for that matter when starting on these particular products. So complications, as far as toxicity goes, I have very low concern about actual toxicity. And we're going to talk a lot about that throughout this lecture. Adverse reactions, we just talked about that. Fairly uncommon, but it does certainly happen, and it's something to be well aware of. Drug interactions are another adverse reaction that we should be aware of. And typically when we have adverse reactions, when the animal is on other drugs, we just really need to reevaluate the dosing of either the CBD product or the conventional pharmaceutical that we are giving that animal. High on my list for some really weird reactions are benzodiazepines and CBD products in particular. It is well documented in human literature, benzodiazepines of any sort, whether it's midazolam, diazepam, alprazolam, mixed with CBD can manifest as what would look like a THC toxicity. Even though you have a hemp product, or maybe you have even a zero THC product, and you mix it with CBD and a benzodiazepine, it looks like that animal might have THC toxicity. It is not THC toxicity, obviously, because you didn't give any, but it is the potentiation of those benzos in conjunction with CBD. Usually, you just stop the dosing and offer nursing care, and the animal will metabolize and be just fine. Other drugs that we might have some drug-to-drug interaction: gabapentin, promazine, tramadol, and phenobarbital and trazodone, we can certainly see some increased lethargy. Typically, this is transient. It only lasts for a few days. But it is notable. If it lasts more than a few days, I would consider decreasing the dose of, again, either the CBD product or the conventional pharmaceutical drug that you're using. Now, something that has never been mentioned in the literature so far, but is noteworthy, is if you're using these compounds, CBD type products, in conjunction with SSRIs, which would also include tramadol for that matter. So technically, tramadol and trazodone together can put your patient at risk for serotonin syndrome. If you add CBD on there, we know that CBD has some affinity, has some stickiness to the serotonin receptors as well. There is a potential that we could be increasing the likelihood of serotonin syndrome. Again, this has not been described in the veterinary literature, but is something to be mindful of. This is something that is being looked at in human medicine, but despite thousands of people mixing these drugs all the time, again, this is not something mentioned in the human literature either, but is a theoretical concern. Now, what we see in clinic. So I mentioned phenobarbital, and phenobarbital is a really interesting drug because we know we can see some liver enzyme changes with phenobarbital whenever we consume any compound or food, and it's going through digestion, and it's being metabolized, and it's going through the liver. Your liver produces certain enzymes to help break down or utilize those compounds that are being filtered through it. And there is some interest with CBD in particular with changing some of those enzymes that the liver is producing, and how that can affect phenobarbital levels in animals or people. Now, theoretically, CBD should be turning off a specific enzyme that would theoretically increase the blood levels of phenobarbital. Now, there's been one meta-analysis study in people showing that that's not really happening in real life. And then we have this study here from Colorado State University with Dr. McGrath's lab, where they found, again, like that wasn't necessarily manifesting in real life. If we read these little excerpts here, it says in humans and possibly other animals, CBD is metabolized by the CYP system in the liver and inhibits several isoenzymes, including CYP2C19, et cetera, et cetera. So speculation exists that CBD could affect the metabolism of certain anti-epileptic drugs. What's important to note from this particular study, that they did not appreciate this. And really the only drugs that were being increased, at least in the human study, were things like clobazam, topiramate, and zonisamide. Zonisamide is a drug that we do use in veterinary medicine, so I would be cautious. I would be very mindful if your animal is on zonisamide and a CBD product at the same time. The other interesting thing that this study found, along with most of the other PK studies or efficacy studies looking at the usefulness of CBD products for osteoarthritis in dogs, did see serum ALP or ALK phos levels increase in dogs. And what's really important to remember about ALP, I'm going to talk about this later in the presentation as well, is this is a pretty non-specific liver enzyme, especially in dogs. And unless we know where the isoform or the enzyme form of ALP is coming from, it's really hard to say, wow, this ALP is going up, the liver must be in shock, or the liver is in danger. Unless we see other liver enzymes increase at the same time, I am not too concerned. And if you ask any neurologist or even any internist, depending on the drugs they're putting them on, they're happy to see, not happy, but they are not surprised or super concerned to see an ALP even double the high end of reference range. So we have to be very cognizant of what these things actually mean, and certainly take that into perspective with the clinical presentation of that animal. Now, cytochrome P450 is what we just talked about as far as anti-epileptic drugs. Theoretically, there are other drugs that we could be concerned about. But again, this is just not something that we're seeing manifest in real life for either human or animal patients to where it's a major concern or a point of concern where we would stop one of these cannabis-based or hemp-based products in a particular patient, especially when we're starting to see positive benefits. But again, it is just something to be very mindful of. When it comes to the liver in general, as I mentioned, we have multiple studies where the ALP or the alk phos has increased in dogs. And what's kind of interesting when it comes to these studies where the ALP has increased in dogs, if you note the dogs that have these increases, or the most common cohort of the animals that have these increases in ALP were typically the geriatric animals, especially if they have osteoarthritis. And so I want you to just kind of pin that in your brain as far as a point that I'm going to come back to, because I think it's really interesting as far as the other pharmacological properties of CBD. My point with this whole little section, however, is to really discuss the ALP increases that we were seeing and where this whole myth of, oh my gosh, it's going to kill the liver came from. So there is this study that was published by some authors that have some really interesting affiliations with other pharmaceutical companies. So that is the first thing I'll comment on this study about. And what they were trying to do was actually give human doses of that purified CBD that I talked about, that's FDA approved, IDEXX, to mice. And so what they did is they scaled the dosing, the total dose that a human would get down to a mouse size. So they were giving these poor rodents 246 milligrams per kilogram up to 2,460 milligrams per kilogram of CBD to these animals. Let alone the method they were doing it was in an oil. They were gavaging these poor rodents, which is taking up a lot of space in the animal's stomach. Obviously, that is also going to impact how much food that animal can be taking, especially when you're gavaging it, probably causing some esophagitis, taking up room in the stomach. They did note the animals were not eating as well anymore. Well, I wonder if you fill up the stomach with a bunch of oil, and especially a super high dose of CBD, it's no wonder that they weren't eating as well. They also did notice some pretty interesting increases in liver values as well. But again, they're giving 246 milligrams up to 2,460 milligrams per kilogram to these poor rodents. These are doses that we are never going to be using in practice. So by and large, this study with its conclusion about hepatic concerns and creating all this fuss and scare tactics within the medical community was, in my opinion, a very poorly designed study and has largely been debunked by most cannabis practitioners in the human and the veterinary world. Now, that's not to discredit the fact that ALP does increase in dogs, but again, it wasn't getting to these points of scariness. It wasn't going past that 2 times the high-end reference range for dogs. In cats, however, we did see the opposite thing happen. We didn't see an increase in ALP for our cat friends, but we did see an increase in ALT, another liver enzyme, in our cat friends. And when I say our cats, it's 1 out of 8 cats that had this spike at 4 weeks, and then it went back down to normal in this particular study. What's important to note about ALT, in particular in cats, is ALT, just how ALP is nonspecific in dogs, ALT is nonspecific in cats. More studies as far as looking at toxicity, liver toxicity specifically in dog friends, comes from this data, which was submitted to the FDA by GW Pharmaceuticals for the Epidiolex product. Again, they were using dosages 10 mg per kg or greater, up to 100 mg per kg in these dog and rat models. What they noted in this particular study were increases in ALP, but also slight increases in ALT in these dogs as well. But again, these are dosages that we just don't really use in these species in most clinical settings. What they noted, even though the doses of ALP increased up to 8-fold at those higher dosages, again, dosages we're not using, and a slight increase in ALT, again, with those higher dosages, clinically, there wasn't a lot of concern and medical management wasn't necessarily needed. But they also did note on histology was hepatocellular hypertrophy. And hepatocellular hypertrophy is something we also see in animals that are on chronic steroids. So if you have an animal that is on chronic non-physiological dosing of prednisone, this is something that you can see in those animals as well. Again, not a huge concern, especially since the liver is regenerating itself. And with stopping these products, the liver will heal itself. The other long-term study that we have that didn't show any long-term negative effects, especially when it comes to the liver, was this study where they were actually trying to induce seizures with high dosages of CBD and high dosages of THC. So this is a 56-week long study. This is just over a year long in dogs. And they were using, again, really high dosages, around 25 milligrams per kilogram of CBD and around 25 milligrams per kilogram of THC. So these, again, are just dosages we're not typically using. And they found no severe adverse effects other than the intoxication by the THC, which there is a tolerance built up to over time. Now, I mentioned ALP is non-specific in dogs. Again, I am really comfortable, as long as we don't have other liver enzymes increasing at the same time, with seeing a double of the high-end reference range of ALP in dogs. If ALT starts to go up, I would be a little bit more cautious. Again, I would look at that certificate of analysis, making sure everything looks kosher as far as cleanliness of that product, and then kind of reassess the other drugs that the animal is on. It is not uncommon, especially in pet populations where owners are using CBD products and things like phenobarbital together, where ALP will start to increase. And what owners are doing with guidance of their veterinarian is decreasing the phenobarbital level, and we will see a decrease in that ALP, which is also nice because the owners typically want a decrease of the phenobarbital and would rather lean on something that's more natural and kind of plant-based. In cats, ALP, if it increases in cats, which we haven't necessarily seen, would be more concerning. ALP is more specific in cats as far as trauma or concern for the liver. ALT in cats, we see cats come in that are stressed out, the ALT spike. We see that drop pretty quickly. We might see a quick spike in ALT after dosing the cat. Especially if it was biting you, we know how much cats hate being pilled. ALT in cats is not as specific as it would be in dogs, so I'm less concerned there. Now, remember that little mental note I told you to take as far as keep this in front of your mind as far as interesting things. So CBD, for whatever reason, has shown, at least in rodent models, to increase lysyl hydroxylase activity in osteoblasts. So there are pharmaceutical companies that are looking at things like CBD for osteoporosis, increasing bone density in those animals, which I think is really, really exciting because it's possible. I'm not suggesting this is what's happening yet. There are studies being done to determine if this is actually happening. Maybe that increase in ALP that we're seeing, especially in those older dogs that have osteoarthritis that are on a CBD product, maybe that ALP isoform is actually coming from bone instead of liver, which would mean that the bone is remodeling, maybe increasing in density, which would be very exciting. Still a lot of work needs to be done there, but just a really interesting postulation that is kind of circulating out there and might be a probable reason as to why that ALP is increasing in some animals. How about those kidneys? By and large, we don't have a lot of concerns so far with using hemp products in chronic kidney patients, whether it's human or animal. There was a study done in animals in particular looking for endocannabinoid system receptors in the renal tissues. By and large, they didn't find a large amount, so I am not really concerned about adverse effects as far as administering hemp products or CBD products to animals with chronic renal failure. I think it might actually be safer compared to non-steroidal anti-inflammatories, which we know if that animal is like dehydrated or misses a meal, we have more concern for those kidneys, whereas we have less concern when it comes to cannabinoid type products. There's even some evidence suggesting that some of these cannabinoid type products can actually increase glomerular filtration rates, which is increasing the efficacy of those kidneys. So when it comes to these chronic kidney patients, this might be a safe and good alternative. Now, when it comes to long-term monitoring, so long-term monitoring to me is typically an animal that is going to be on a hemp product greater than 2 weeks, right? So like most chronic medications that we're going to be giving animals, it is always a good idea to get a baseline as far as blood work is concerned for that particular animal while they're on this product, whether it's phenobarbital, like we check levels all the time, we check the liver all the time, we check phenobarb levels, or non-steroidal anti-inflammatories, we often check those levels Q3 to 6 months. So in general, I think this is the safe thing to do until we have better literature suggesting otherwise for our animals that are going to be on these products long-term. Again, something greater than 2 weeks. What's cool is IDEXX does have the perfect little clip for this right now, but the main values that we want to be assessing for our animals that are on these products are ALP, ALT, and AST minimum. And then we might want to consider things like bile acids. And if that animal is on phenobarbital, I think that's worthwhile looking at. In clinic, I believe they have those phenobarbital little slides that you can use on your in-house monitoring. And C-reactive protein, this is not something that is done a lot here in the US. I think we should be using this more. I'm a pain guy. I really like to see inflammation levels decrease, hopefully with effective therapy. This is something that we could potentially utilize to see the efficacy of these products, especially in animals that have chronic inflammatory diseases, such as osteoarthritis. And like I said, IDEXX does have that perfect little clip for kind of monitoring long-term patients that are on these products. And I use the NSAID clip. It has all the things that I want to see for these patients that are on these products long-term. And again, I really want to hit home with potentially using these CRP profiles. CRP is a C-reactive protein, is a specific inflammatory marker that we note can increase with certain disease states and decrease with other and decrease with treatment plans. So this is something that I think is really interesting that is being looked at not only in humans, that are on cannabis-based products, usually marijuana products, but also something that's being used in animals more commonly in Europe as well, as far as assessing the efficacy of a therapeutic process or therapeutic plan that we are doing on an animal to, again, assess the efficacy for that particular therapy. With that, I am done. I want to thank you so much for listening to this. If you have any questions, please feel free to reach out to me through my website, stevencital.com. And of course, this is an Anesthesia Nerds and IDEXX kind of collab here. So find us on Facebook on the Anesthesia Nerds, Veterinary Anesthesia Nerds. It's only for veterinary professionals where you can ask all your questions as it relates to anesthesia and pain management. With that, I'm Steven Cital. Thank you so much for joining me and have a good one. Bye.
Thank you again, Mr. Cital, for that valuable presentation. And thank you to everyone watching. We have many more IDEXX educational offerings available, which I invite you to check out. To exit this session, simply close your browser. Thank you so much.